Well, good morning. Good morning. This is Dr. Yonette. Look, I slept like a baby last night. I had such an awesome sleeping experience that I woke up a little late this morning. But I'm sure your baby is also sleeping so much better, and you are getting some of the rest that you have lost by having to get up so early and so often. So today I want to again kind of deviate from what I said I was going to be talking about, and that's play. Because, I like it when I'm able to interact with my audience and you share with me your experiences so I can address your needs. So today I want to go back and revisit breastfeeding. Let's talk a little bit about breastfeeding, and we're going to talk about weight gain. What can you expect when you are breastfeeding, and what kind of weight gain can you expect for your baby? Okay, so every single mother has a different experience with breastfeeding. So your experience might not be my experience, but we can still collaborate. Whether this is your first baby or you have many babies, each baby is also unique. So breastfeeding is really a learning process. I remember when I first got my baby handed to me to start breastfeeding, that my baby wouldn't latch on. So it's all a new process and experience for both baby and mom. So the baby is learning how to latch on to the breast, to suck and to swallow. And at the same time, you as mom, you are learning how to position your baby to feed. You're observing and following his or her hunger cues, and then you're also managing your breast milk supply and your breast health. So let's talk about a few things to expect when you are breastfeeding. So during that first week of birth of your baby, you will produce this yellowish substance that we call colostrum. And colostrum is packed with nutrients and other substances to help your baby build up his or her immune system. But according to the experts, in about 3 days or so, your milk should begin to look more like milk, and your breast will become fuller and harder and warmer. So the next thing you're going to notice is that your breast may feel full and leak over time. But this should stop. Again, going back to my experience, for me, I had so much milk production. So I ended up pumping and storing the excess milk and using a disposable cloth or pad in my bra to keep my clothes from getting wet. So there are some ideas that you can incorporate. Over the first few weeks, you may find that your breast is fuller and harder and warmer and even painful. And this is normal. This is called engorgement. But by feeding your baby regularly, you should experience less pain. Now, if you're having sore nipples and pain while breastfeeding, which sometimes is experienced by some women in the first few weeks of breastfeeding, you can speak to your lactation nurse or to your doctor about it. So let's talk a little bit now about the health of your breastfed baby. Are you noticing that he or she is not gaining weight, or are you concerned that he or she is not getting the nutrients needed to grow and gain weight? Well, let's talk about that. According to the World Health Organization, healthy breastfed infants typically gain weight faster than formula-fed infants in the first few months. Did you know that? In the first few months of their lives, breastfed babies typically gain weight faster than formula-fed babies. But then they more Okay, I'm stumbling over myself. But later on in their infancy, they, even when you add regular or complementary foods, breastfed babies tend to gain weight at a slower rate than formula fed babies. So in the first few months, they gain weight faster. In the later few months, they gain weight slower. So look out for that and don't be alarmed if you see that. Let's look at what kind of weights we are talking about in your baby. In an average baby, birth rate in a full-term male baby is between, I think it was, I'm missing that bit of stats. I'm going to go back and get this so I'm very accurate, but I want to say between 8 to 9 pounds. In the average weight for a full-term female is 7 pounds 2 ounces. But average weight for a baby boy or a baby born between 37 and 40 weeks range from 5 pounds 8 ounces to 8 pounds 13 ounces. At delivery though, consider a low birth weight to be less than 5 pounds 8 ounces. It is common though for babies to lose about 10% of their weight shortly after birth. And this decrease is really mostly because of the fluid buildup that they had in their body. But it's nothing to worry about because most babies gain back their weight within a week. Breastfeeding and weight gain are the two things I want you to journal about this week. Pull out your journals and make note of what you are observing in your baby. Make sure you are following it and you know exactly what is taking place. And I want to go back and give you the stats on male babies that are born full term. Their weight is usually 7 pounds 6 ounces, while females it's 7 pounds 2 ounces. Now, are you concerned about your baby's weight gain? Are you concerned about your baby's weight gain? Now, if you are, I don't want you to just sit there and do nothing. Speak with your pediatrician. Look at your baby. Is your baby's skin falling out? Is it no longer as saggy as it was before, soggy as it was before? Look at your baby. Journal so you see what's happening, and always be proactive. Advocate for your baby so that he or she can have a healthy life and have a healthy body and live a productive life. This is Dr. Yonette speaking with you this morning and thanking you for joining me. Remember, subscribe to my YouTube channel. I want you to join my Facebook page, Skincare Explosion with Dr. Yonette. Send me your questions and your comments. Share your videos and share your pictures. And let's help baby grow and develop together. Have a great day.